Every year, hundreds of thousands of people develop blood clots that go completely unnoticed until they suddenly become a medical emergency. What makes this especially dangerous is that the body often sends quiet warning signs hours, sometimes even days before things turn serious. The difference between recognizing those signs early and missing them can quite literally be the difference between a manageable situation and a life-threatening crisis. This becomes even more important after the age of 60. As the body ages, blood tends to become slightly thicker, circulation can slow down, and people are generally less active than they used to be. On top of that, conditions that affect the heart and blood vessels become more common. All of this creates an environment where clots are more likely to form, often without any obvious trigger.
One of the most common types of clot is called deep vein thrombosis, often shortened to DVT. This type of clot typically forms in the deep veins of the leg, especially in the calf or thigh. And while it may sound serious, which it is, the early signs can be surprisingly easy to overlook. It often starts as a dull, aching pain in the calf. Not sharp, not sudden, just a persistent discomfort that doesn't quite feel normal. Some people describe it as a cramp that doesn't go away, or a tightness that worsens when they walk or flex their foot upward. Then there's swelling, but here's the detail that matters most. It usually affects only one leg. One calf may look visibly larger than the other. One ankle may feel tighter. This kind of asymmetry is one of the most important warning signs. If both legs are swollen equally, it's more likely related to fluid retention from heart or kidney issues. But if one leg is clearly different, that's something you should never ignore. The skin over the affected area can also change. It may feel warmer than the surrounding skin or more sensitive to touch. In some cases, you might notice a slight reddish or even bluish discoloration along the path of the vein. These are all signals that something is happening beneath the surface. Now, the reason DVT is taken so seriously is not just the clot itself, but what can happen next. If a piece of that clot breaks loose, it can travel through the bloodstream and reach the lungs. When that happens, it becomes something called a pulmonary embolism, and this is where things become life-threatening. The warning signs here are different, and they tend to appear more suddenly. One of the most common is shortness of breath that seems to come out of nowhere. You might feel like you can't get a full breath even when you're resting. Chest pain is another key symptom, especially pain that worsens when you take a deep breath. It's often described as sharp or stabbing, and it doesn't behave like typical muscle pain. Along with that, there may be a cough, sometimes producing small amounts of blood-tinged mucus. Your heart may start racing or beating irregularly, even if you're not doing anything physically demanding. You might feel lightheaded, dizzy, or close to fainting. These symptoms can come together quickly, and when they do, they require immediate action. This is not a situation to wait and see. Emergency medical care is critical. What makes all of this more concerning is how easily risk can build up without being obvious. Long periods of sitting are one of the biggest contributors. That could be a long flight, a long car journey, or even just sitting for hours without moving much during the day. When your legs stay still for too long, blood flow slows down, especially in the deeper veins. That slower movement increases the chance of clot formation. It's a simple mechanism, but it has serious consequences. Certain medical conditions also increase risk. Irregular heart rhythms, such as atrial fibrillation, can affect how blood flows through the body. Cancer and its treatments can make the blood more prone to clotting. Dehydration thickens the blood, making it less fluid and more likely to clot. Hormone therapies can also influence clotting factors in the bloodstream. The important thing to understand is that risk doesn't always come from one major factor. Often it's the combination of smaller ones, a long trip, less movement, mild dehydration, that together create the conditions for a clot to form. The good news is that prevention is often simple and practical. Staying hydrated is one of the easiest and most effective steps you can take. Water helps maintain proper blood consistency, reducing the likelihood of clot formation. Movement is equally important. If you're sitting for long periods, even a few minutes of movement every hour can make a significant difference. Standing up, walking around, or even doing small movements like ankle circles or calf raises helps keep blood flowing properly. During long travel, compression stockings can support circulation in the legs, especially for those who already have risk factors. And maintaining a regular walking routine in daily life, even light, consistent movement, goes a long way in keeping your circulatory system functioning well. What matters most is awareness. These symptoms don't always appear dramatically. They can be subtle, easy to dismiss, easy to explain away as something minor, but your body rarely sends signals without a reason. Recognizing those signals, especially when they involve one-sided swelling, unexplained pain, or sudden breathing difficulty, gives you a chance to act early, before the situation becomes dangerous. Because when it comes to blood clots, timing matters. The earlier you notice, the more options you have, and the better the outcome tends to be. It takes only a few minutes to understand these signs, but that awareness can stay with you for years, and in the right moment, it can save a life.